post-transplant cyclophosphamide prophylaxis is really, one of the most important development in transplantation. It was pioneered in Baltimore, and it enabled us to do a haploidentical transplant without depleting of T cells from the graft. So because of the broad HLA disparity in the beginning of the, 30 years ago or so, when people try to do haploidentical transplant, it always ends with lethal grade 4 GvHD. And so it was not possible to do this transplant. Then came the way to do it, the technique, by depleting completely the immune system, the T cells from the graft, and giving in the transplant mega dose of hematopoietic stem cells, CD34. But this results in very strong tolerance and also against the leukemia. So the relapse rate was high on the one hand, and also that we did not have immune system to battle the infectious disease. So transplant-related mortality in T-depleted haplo was high and relapse rate high. The post-transplant cyclophosphamide as GvHD prophylaxis enable us not to deplete the immune system from the graft. So now we have a strong graft versus leukemia effect in haploidentical transplant, and also reduction in transplant-related mortality and infection disease. There is high relapse rate in haploidentical transplant, but this is because of other reasons, in which called HLA haplotype loss. So in 25% of the haploidentical transplant, the leukemic blasts are losing one of the haplotype. And then the immune system cannot recognize them, and there is no graft versus leukemia effect, but high in the relapse. But the post-transplant cyclo, on the other hand, enable to shorten the period that the patient needs calcineurin inhibitor-based immunosuppression, and therefore there is less toxicity and less infection disease. Post-transplant cyclo is moving now to unrelated transplant, mismatch unrelated transplantation, still under clinical trials, but more and more centers are using post-transplant cyclo also in the unrelated setting. For the sibling setting, in a bunch of papers from the acute leukemia working party, we were able to show that there is no advantage of post-transplant cyclo over ATG, another way to reduce graft-versus-host disease in sibling transplantation.